I'm not going to go through all the chemistry, but I do want to point out one thing that's really important, and that is the metabolic switch that occurs when you're in a pro-inflammatory state versus a pro-resolving state. The delta is an M1 versus M2 macrophage. That's a sentinel sign that when your M2 macrophages are predominant, you're in a pro-resolving state. When your M1 macrophages are predominant, you're in a state of terrible inflammation. And you're going to get cytokines, you're going to get endothelial dysfunction, you're going to get nitric oxide production that's reduced. You're going to get a whole host of factors that are a problem. And I know from the standpoint of orthopedics, you don't necessarily want to think about that, but these are all important, and I'm going to show you why. If you look at the original fat model, and this is, if you go back to bees, they have the same concept. If you look at, this is the studies were done on bees initially. They have something called a fat body. The fat body has three components. It has a fat component, it has a humoral component, and it has an inflammatory component. And it just so happens that in the adult human, we took our fat, and most of it's viscerogenic and sub-Q, but it's the viscerogenic fat that maintains the inflammatory component, which is the component around the gut. We took our humoral component and shoved it into our bone marrow. But we're still maintaining a significant amount of inflammatory cascade in our peripheral fat, and most of that comes from the visceral fat. Now, the white adipose tissue that's sub-Q still has adipokines that are associated with it, specifically leptin. But a lot of our inflammatory component is right in our viscerogenic compartments, right around our gut. So if our intestines absorb something that we're not supposed to have, we get an immediate response from the immune cells around the intestine, which are living in the fat cells. And the more fat that you have there, the more exaggerated the immune response. If you look back at COVID, you'll find out that most of the people that died from COVID, that had respiratory failure and died, the vast majority died from thromboembolism. They died from a systemic overreaction of their immune system. They actually didn't die because they had a suppressed immune system. They had such a cytokine storm, and they had such high leptins being released from their white fat that they died from that. And then they got into pulmonary edema, and it was the fact that they had overdone their immune system, very akin to what HIV does. HIV kills you not so much from the fact that you're suppressing your immune system. HIV, actually, your immune system starts to go against your own body, and that's what kills you.